Hi, I'm Dr. Jonathan Weisman in Fremont, California. Today I'd like to dispel a myth. It's about when sleep apnea starts. I think the common misconception, and one that I believed for many, many years, is, we get to be about 50, gain some weight, get sleep apnea. And I'd like to inform you about some things that may change your mind on that. So, obstructive sleep apnea happens when the jaws don't grow out and wide full enough to where the tongue can live out and wide. If the jaws don't form, the tongue has to come back. It actually obstructs the airway. So this would be a skull with a normal jaw teeth scenario in front of the eye socket, and probably a skull like this would have the tongue living appropriately. So most of the jaw growth happens by age 4, 75% of your growth. And if you don't get that opportunity, then the jaw isn't going to form, the tongue will live back. So how does the baby skull form a good jaw? So pressure is what forms the bones here. The long bones of the body is mostly genetics, but this is pressure. The brain is a great example. As it grows, it's going to stretch this membrane, and so these bones that are in the membrane growing together get stretched apart. When the brain finishes, the bones grow together, and so the brain makes the perfect house for itself, which is very, very important. Now, the jaws grow by the tongue. The tongue wants to make the perfect house for itself, and as long as the tongue isn't tongue-tied, and as long as the tongue is used in the right way, it will form out and wide. So here's the formula. It's breastfeeding, going to hard food. Before electricity, so only 300 years ago, when there were no baby bottles, formula, or blenders, the recipe was breastfeeding for 2 to 4 years, and that action is a very powerful action that will form the jaws out and wide, again, as long as the tongue isn't tongue-tied. Then you transition to hard food like carrots or dried meats, things like that, normal food, and we call it the muscles of mastication, the chewing muscles, will act and the tongue will continue that process. So what I'm trying to tell you is, by age 4, we can probably tell if you're tracking for sleep apnea. A 4-year-old should have such gapped teeth that the permanent teeth will come in straight. And if you see a 4-year-old with tight teeth that are grinding their teeth, then they're already tracking for sleep apnea. So the real scenario is insufficient jaw growth early, goes to airway obstructive breathing in youngsters, goes to tired children, or poor diet anyway. Then you get some weight gain later in life, but really you had obstructive airway early and then weight gain, which makes it worse. So that's when it's diagnosed, but it really starts at a much younger age. Hope that was clear and interesting.